to develop them and make them contribute to the national development agenda, it is only through agriculture that you can develop them.
Governor Lamin Jammeh urged stakeholders to be action-oriented and add values on achievements registered in all national endeavors. Officially handing over the seeds, the Agricultural Regional Directorate wasted no time in loading trucks for distribution of seeds for cultivation countrywide. Mamadou Diallo, GRTS.
Two local NGOs this morning signed a grant agreement with the United States Embassy in Banjul. St. Joseph's Family Farm and Hope for Children Gambia are to commit $25,000 to projects designed to enhance the livelihoods and income-generating capacity of refugees residing in the Gambia. Laikuma Demba has the rest of that story.
In a world where food insecurity, climate change and conflict force people out of their homes or countries, it is developing countries that tend to feel the pinch. According to the United Nations High Commissioner for Refugees, the Gambia is host to approximately 9,976 refugees from around the continent. The refugees, a number of whom are engaged in skill acquisition in the country, are finally making some progress in acquiring gainful social services during their integration process. Cognizant of the above, the United States of America, through its embassies, signed a grant agreement with two NGOs in the Gambia, Hope for Children Gambia and St. Joseph Family Farms. The grant, amounting to $25,000 is divided into two portions. $10,000 for Hope for Children and $15,000 for St. Joseph's Family Farms is expected to set the stage for a project aimed at boosting the income capacity and livelihood generations for refugees and returnees from the Casamance region. The project, entitled Support to Refugees, Returnees from Casamance, also seeks to address some critical needs of the refugees and their host families in the West Coast region.
And one of the needs that is here in the Gambia that is really, really overlooked are the refugees, but not only the refugees, but the host families who have taken them into their compounds. And this is what we really have to commend the Gambians for. A lot of the people who are coming up over the border from Casamance, they might have distant relatives here, they might not have any relatives, but the Gambians are taking them in and hosting them and giving them a home. And they're sharing the last little bit of rice they have, they're sharing their homes with them, and these people are the ones who we're also trying to help with these grants.
The United Nations High Commissioner for Refugees said the American Embassy has long been partnering with NGOs in similar initiatives.
We have so many vulnerable groups among the refugees. U.S. government has always been the biggest donor for UNHCR. So we sincerely thank U.S. government over and over again for coming to the assistance of refugees.
For the agencies charged with the responsibility of implementing both projects, they are optimistic that they will deliver the goods, noting that the grants have come at the right time.
This is really going to help the refugees a lot, given the fact that refugees are a very vulnerable group in society and they need a lot of support because they lack a lot of things. You see, when they came virtually with nothing. And all the support, all the livelihood they've been supported with is really coming from support here and there.
And Hope for Children and St. Joseph's Farm, Buyam, have been the lucky ones. It is going to make a big difference. I, as board chairman, I'm committed to ensuring that the funds are utilized for the purpose it is meant. And I can assure you that that's going to happen. We are more concerned, Hope for Children is more concerned with increasing access to social services.
Officials are of the belief that partnerships such as these are needed to improve the lives of refugees. It also goes to show with unity, much can be achieved. For GRTS News, I am Laikuma Demba.
A forum organized by the Ministry of Health and Social Welfare and West Africa Health Organization is working on means of harmonizing integrated non-communicable disease action plans for resource mobilization and implementation in West Africa. Fatou Jassy reports. Harmonizing integrated non-communicable disease action plan for resource mobilization and implementation for West Africa region is the theme for a two-day synergy organized by the Ministry of Health and Social Welfare in conjunction with West Africa Health Organization and other stakeholders. In response to the ever-growing damage caused by NCDs, health organizations, according to officials, should prioritize their prevention and treatment methods.
You will agree with me that harmonization of integrated NCD action plans for resource mobilization and implementation will certainly facilitate effective coordination for the implementation, which would certainly facilitate effective, cost-effective and sustainable strategies, all in the prevention of and control of NCDs in the sub-region. According to the WHO report in 2011, NCDs accounts for 36 million deaths annually and more than 63% of all deaths worldwide, which is as cases of cardiovascular diseases, cancer, chronic respiratory diseases, and diabetes, which are most commonly causes of mortality and poor health.
Africa, as highlighted, carries much of the body in combating communicable and non-communicable diseases.
Africa is faced with a persistently high burden of infectious diseases while experiencing a rapid emergence of NCDs. One of the most challenging situations in Africa is this double burden of diseases. The landmark Brazzaville Declaration on NCDs was adopted in April 2011 by more than 30 ministers of health, 15 high-level heads of delegation, and some 150 experts from the African region, partners and civil society organizations who attended the regional ministerial consultation on NCDs organized by AFRO. The adopted Brazzaville Declaration, which recognizes NCDs as a global development issue, increased awareness and outlined required actions for NCDs prevention and control.
With the current global financial crisis, the emergence of such threats simply slows down socio-economic development of affected countries.
At country level, almost all member states have appointed NCD control focal point and have a structure within the Ministry of Health indicated to NCD control. Health system must therefore meet the needs related to non-communicable disease control. However, it is clear that many challenges still lie ahead in the member states and with the development partners to effectively control NCDs. These include the inadequate allocation of human and financial resources, good governance for equitable access to healthcare in order to achieve effective and sustainable health system. There are also challenges in terms of efforts toward raising people's awareness about these devastating diseases and the risk factors.
With the level of participation present, officials are optimistic of a fruitful outcome that will commit member countries to implement various resource mobilization plans to prevent and overcome the effects of the deadly phenomenon. For Grts News, I am Fatou Jassi. We now take our first break. We'll be right back.
What's your AfriCell number?
773.
What's your mobile number?
735.
What's your AfriCell number?
746.
What's your number?
My number is 215. 2?
You mean 72?
No, it's 2, and I am AfriCell 2. AfriCell 2? Hey, hey! Yes, 2 is AfriCell 2. Hey, hey! AfriCell introduces the new AfriCell series, the number 2.
Welcoming the number 2 to the AfriCell family.
From now on, the AfriCell lines will not only start with the number 7, but also with the number 2.
Get a new AfriCell SIM card now that starts with the number 2.
So now I can get an AfriCell number that starts with the number 2?
Yes. And when you receive a call from a number starting with the number 2, it's one of the new AfriCell lines calling you. My mobile number is 2, and
we are AfriCell 2!
Welcome back. rescue